Good afternoon, and thank you for joining us for today's CMS 1500 webinar. I'm Jen Donovan from the Stakeholder Engagement Unit here at the Workers' Compensation Board, and presenting today is Sarah McDonald, also from the Stakeholder Engagement Unit here at the Board. To assist with your questions today, we have several board staff from our Medical Director's Office and our Data Management and Analysis Office. Today's focus will be on the new requirement for providers that you must contract with an electronic submission partner to submit the CMS 1500 Universal Medical Billing Form electronically on your behalf starting August 1st, 2025. We want to encourage you to not wait until August to connect with a submission partner. Go ahead and do that now to determine which one can meet your needs. We're going to start with a brief overview of the CMS 1500 initiative, review the significant benefits of electronic submission, share the currently available submission partners, and take a look at the submission partner. There will be time at the end for your questions. We ask you to please keep your phone lines muted as we will be using the chat feature to receive your questions at the end of today's presentation. You may enter your questions throughout the presentation in the chat box located on the right side of your screen. We will answer as many questions as we can, but if you have questions we don't get to today, or if you think of something after the session ends, we will be providing you with resources at the end of the presentation. A recording of this webinar will also be available on our website and YouTube page in the coming days. At this time, I will turn it over to Sarah for today's presentation.
Thanks, Jen, and good afternoon, everyone. Today's presentation will discuss a new component of the CMS 1500 initiative, which is mandatory submission through an electronic submission partner, beginning August 1st, 2025. We will start with some background on the initiative and discuss the benefits of electronic submission and how well it's going. We will then review available submission partners, how to register for submission of your CMS 1500 forms, and review the process as well as some additional reminders you should be aware of. We will then spend the rest of the time answering any questions you may have. The Workers' Compensation Board, or the Board, transitioned to the universal form to reduce the administrative burden on participating providers, who previously had to use separate board-specific forms for their workers' comp patients. Electronic form submission provides an infrastructure to allow the submission of data to the Workers' Compensation Board in an industry-standard format. Since July 1st, 2022, healthcare providers have been required to use the CMS 1500 for all workers' comp medical billing. As part of the initiative, use of prior medical billing reports include Doctor's Initial Report Form C-4 and Doctor's Progress Report Form C-4.2 have been discontinued. Providers must also prominently report the injured worker's temporary impairment percentage, work status, and the causal relationship of the injury at the top of the CMS 1500 form medical narrative. Note, provider types who are not permitted to opine on the causal relationship or level of impairment are not required to submit this information. Beginning August 1st, 2025, electronic submission to an electronic submission partner will become mandatory. The board is thrilled with the success of the CMS 1500 form so far. Since July 1st, 2022, more than 15.2 million CMS 1500 forms have been submitted, including 4.8 million electronic submissions through an electronic submission partner. More than 14,200 providers have submitted their CMS 1500 forms electronically through an electronic submission partner. The board provided notification of the new requirement in August and November 2024. There are many benefits to providers, which we will go over shortly. The board will not act on or enforce payments of a paper CMS 1500 form submitted on or after August 1st, 2025. Forms that are submitted prior to August 1st, 2025 will continue to be processed, but providers are encouraged to transition to electronic submission well in advance of the mandatory date to reduce the likelihood of submissions being lost in the transition. Now we will take a minute to highlight the many benefits of electronic submission. Faster bill payments. Providers typically get paid quicker. Reduced administrative burden. The electronic submission partner submits the CMS 1500 to the insurer and the board. Providers will have the confirmation within 7 days that their bill was accepted or rejected by the insurer. With date timestamp acknowledgement of receipt from the insurer, the provider is aware that they do not need to resubmit the bill. Technical errors are identified quickly so they may be corrected and resubmitted, instead of waiting for the insurer to deny the bill, and no cost or low cost. Now we will review the steps providers need to take to register for the electronic billing through an electronic submission partner. The medical portal provides access to the online services the board offers, including registration for electronic submission of medical bills to insurers and the board. Once you have accepted the terms of electronic submission agreement, you can then discuss details of submission with an approved electronic submission partner, also known as a clearinghouse. The electronic submission partner ensures that the medical bill and narrative attachment are sent and accepted by the correct payer and the board. After logging into the medical portal, providers who have not already signed up for an electronic submission of the CMS-1500 will see a link for Agreement for Electronic Submission of CMS-1500 under the Billing section. Select the link and select the I accept button. The provider's name will be added to the listing of providers authorized to submit electronic data, which is updated daily. Once accepted, the link will no longer appear when you sign in again. There are currently 8 approved electronic submission partners. In order to ensure the integrity of the electronic submission process, the board requires all prospective submission partners to engage in a rigorous testing effort. Approved electronic submission partners have executed a legal agreement with the board. You can find a published listing of all clearinghouses who are interested, testing, or approved electronic submission partners for the CMS-1500 by visiting the providers page at wcb.ny.gov. Select Electronic Form Submission under the Billing tab of the Resources section. It is important to note the board does not endorse any of the electronic submission partners who have shown interest in or who have been approved to provide these services. The board has no knowledge of any other aspects of the electronic submission partner's business. Thus, the board makes no representation of warranties expressed or implied as to any aspect of the electronic submission partner's business. After registering with the board, you may submit the bill and narrative attachment to the electronic submission partner by an agreed format, and they will electronically forward both to the workers' compensation insurer. Providers who wish to continue using paper bills will still have the ability to submit a paper CMS-1500 form to certain, but not all, electronic submission partners, who will then convert it and submit it electronically to the payer and the board on the provider's behalf. Providers who wish to submit a paper CMS-1500 form must ensure the submission partner that they contract with has this capability. There are submission partners who take paper and those who do not. The insurer will then accept the CMS-1500 form from the electronic submission partner and return electronic acknowledgement of receipt. The electronic submission partner will forward the acknowledgement, including the date it was received, to you. The electronic submission partner will also transmit billing data, the CMS-1500 forms, and narrative attachments, and the insurer's acknowledgement of the receipt to the board. When the CMS-1500 form and narrative is submitted through an electronic submission partner, providers should not mail, fax, or email a duplicate bill to the board. Providers who are required and permitted to do so are strongly encouraged to use the narrative template to create the medical narrative report that must be submitted with the CMS-1500 for ease of locating essential elements of causal relationship of the injury or illness to the patient's work activities, patient's work status, and temporary impairment percentage. For those using their own template, please remember to include these elements in a highly visible location on your reports. Payment may be denied when a bill is submitted improperly, for example, not submitted electronically through an approved electronic submission partner. Very important. When a WCB case number is available, it must be populated in field 9A. Failure to do this may result in the CMS-1500 not being matched with the correct case, resulting in a delay of review and payment. Providers decide which electronic submission partner they want to use. Costs and services may vary by company. View the board's list of approved electronic submission partners. Providers will have the ability to offset the cost of using an electronic submission partner by using code 99080. This was previously a no charge or an NC code in the fee schedule listed as special reports such as insurance forms, more than the information conveyed in the usual medical communication or standard reporting form, which may be used as a buy report or BR code up to a maximum value of $1. The code should be placed on the same CMS-1500 form for which the billable services payment and the electronic submission costs are being requested. The price listed by the provider code for 99080 should accurately reflect the actual cost incurred by the provider for the electronic submission of the individual bill, up to a maximum of $1. Note, a provider who currently submits a CMS 1500 electronically via an electronic submission partner can bill to offset the cost. When billing for a permanency evaluation, the doctor's report of an MMI permanent impairment, Form C-4.3, must be attached to the CMS 1500 as the medical narrative. If you send a separate C-4.3 form to the board, it will be rejected. If there are more than 6 line items for one date of service, you may submit multiple CMS 1500 forms together, with the total charge amount appearing only on the last form. Finally, be sure to enter the information correctly on the CMS 1500, including payer and employer detail, as indicated on the requirements page of the board's website. Other news of interest related to billing. On January 6, 2025, the board issued new guidance payers to reduce the improper objections to medical bills. The new guidance also published on the board's website includes when not to file Form C-8.1B, a list of reasons that cannot be used to file the form. When Form C-8.1B is needed, a list of requirements for proper submission of the form. Reminder, earlier this year, the board created a new medical billing dispute section of our website to assist providers and payers with dispute process. The site details documentation and other requirements for common scenarios. You can visit the link on your screen for additional details. For more information on the CMS 1500 form, including a list of electronic submission partners and discontinued forms, please visit wcb.ny.gov/CMS-1500. We have a dedicated mailbox to answer all questions on the CMS 1500 initiative. The email address is cms1500@wcb.ny.gov. As a reminder, if you're not already following the board on social media, we encourage you to do so. We are on X, Facebook, Instagram, YouTube, and LinkedIn, so link up with us. You can also subscribe to get board updates, the same ones our external stakeholders do, by hitting Get WCB Notifications on the bottom of our website. Thank you for taking the time to learn about the CMS 1500 and all the benefits that submitting electronically offers. We would now like to take the rest of the time to answer your questions.
Thank you so much, Sarah. We are going to take a couple minutes to go through the questions that have come through the chat. So you might hear a brief silence. We will be right back with you shortly. Thank you.
Hi, this is Paula. We have a question on whether or not someone with 10 or less would need to submit electronically. The answer is yes, there are no exceptions.
And this is Dr. Tachi. I would just say for those very small providers that are low volume, some of our electronic submission partners do allow for you to give them paper claim forms, and they will convert them into the electronic format and submit them for you electronically. So that might be the best option.
Hi, this is Audrey from the Medical Director's Office. So there's a question with respect to injured workers who have services out of state. And so this requirement does apply to providers who treat out of state. Those such providers must submit electronically after August 1st. There's also a question with respect to our 8 electronic submission partners, and those are listed on our website. The Workers' Comp Board website lists them with contact information.
This is Jen. I do see several questions regarding the availability of this presentation. A recording will be available on the board's website in the coming days. You can visit the recorded webinar section of the website. You also want to make sure you're subscribed to get our updates by visiting wcb.ny.gov, scroll all the way down to the bottom and click that Get WCB Notifications button. We will notify you when the presentation becomes available on our website.
Hi, there's a question with respect to where does the offset go on the billing form. So the code for the offset is 99080, and that goes in the billing section of the CMS 1500, just like any other CPT code. And I will remind folks that that offset is one time per bill. So that's to be used one time per bill.
Hi, this is Dr. Tachi, and there's a question or comment. It says that they have an agreement with one of the electronic submission partners. They have successfully tested and submitted a few claims. However, some are being rejected, and they believe that it's because not all of the providers have registered on the Workers' Comp Board portal. They believe it might be some of their older providers that haven't set up accounts yet. The question is, do all providers need to set up a Workers' Comp Board portal account individually? And the answer to that is yes. In order to submit bills in that provider's name, that they have to be registered with the portal by individual provider. We do understand that some providers may not be perhaps as tech savvy as others. If folks are having difficulty with the registration process, there are detailed instructions online. But if they're still having difficulty, if you want to reach out to us at the medical director's office, we'd be happy to have somebody from our team give you some assistance.
Hi, this is Paula. There's a question. If our current electronic billing system, who is not on the list, and you're using, do have the ability to send workers' comp claims to the payer, why can't you use the one you're currently using if they can already send the bills to the carrier? They have to go through an approval process, which is on our website. We can give you that link again at the end of this presentation. And once they are approved, then you can use them.
Hi, this is Dan. We have a question. Will you accept bills submitted via WCB conduit website? Any bills that go through the new electronic submission process that will go through an electronic submission partner are no longer required to be submitted to the board through the conduit website. Also, what will the payer ID be used for submission? All the electronic submission partners that you will partner with will know the correct payer ID for the correct carrier or payer.
This is Dr. Tachi. There's a question, and I think that warrants sort of reiteration. The question is, if a provider is not XML certified, will there be an option to submit the claim on paper on or after August 1st of 2025? Just to be clear, this is not a certification process for our providers. Our providers don't have to become certified in submitting electronically. Our providers merely have to contract with one of the 8 XML or electronic submission partners, and the electronic submission partners will do that on your behalf. In terms of being able to submit the claim on paper, you can then, as we mentioned, not all, but some, I believe actually a majority of the electronic submission partners are willing to take a paper claim form from you, convert it to an electronic format, and submit it on your behalf electronically. So it's not a matter of our providers having to become certified in anything. You just have to contract with one of the submission partners.
Hi, this is Jen again. I'm seeing some additional questions about the availability of this presentation. As I mentioned a little earlier, this will be available in the coming days on the recorded webinar page of the board's website. You can also sign up to receive board notifications, so you'll get an email when it becomes available. Visit wcb.ny.gov, scroll all the way down to the bottom of the homepage, and click that Get WCB Notifications button.
This is Dr. Tachi again. There's a question that states, if an insurer doesn't currently accept electronic claims, one of your e-vendors will facilitate submission and that payer must accept the electronic claim. Just to be clear, the payers are already required to accept electronic submissions. So the only change in the requirement in August will be for providers being required to submit them electronically, but payers are already required to accept them.
Hi, it's Audrey again. There's a question with respect to the date of August 1st, whether or not this means all dates of service from August 1st on must be submitted electronically, or rather all submissions made from August 1st on. And it's all submissions from August 1st on. So August 1st is the date.
There's a question, if we already use a clearinghouse for some of our payers, but others are not established with them, do we need to contract with multiple clearinghouses in order to continue submissions? And I would say the answer to that is no. That's actually one of the nice parts about this system and use of the clearinghouses, is that any provider or any practice only needs to contract with one clearinghouse. And then when you have them do your submission for you, they'll either be contracted with the payers to submit your bills electronically to them, or they will route them through one of the other clearinghouses for timely submission as well.
Currently, there are some questions regarding the WCB case number being put into field 9A. And this is a situational field, and the bill will go through without that WCB case number going through, because there are some situations where that won't be available by the board as in the early part of a claim. But once that is available, it's very important to put the WCB case number on the bill to ensure that things are being adjudicated properly. And the same goes for the Social Security number in field 1. It is an optional field, but in order to get the claim adjudicated properly both by the proper carrier and by the proper unit within the board, those pieces of information are very important.
Hi, there's a couple of questions about code 99080, the offset, and whether or not it can be used now or whether folks need to wait until August 1st. You can, if you are using an electronic submission partner currently, you are able to use that code now. Hi, there's a question with respect to a particular XML submission partner by the name of Keras, and if you are using them currently, they are an approved XML, or rather electronic submission partner, and you are able to continue using them.
There's a question, are we to report 99080 along with the other CPT billed charges on the CMS form? The answer is yes. In fact, you're supposed to use the 99080 code on the same form for which reimbursement is being sought. So you submit your CMS-1500 with whatever the clinical charges are for clinical services, and then there will be a charge presumably by your clearinghouse or by your submission partner for the submission of that particular form. So it's on that form that you would put, the same form you would put the 99080 code.
Hi, there's a question with respect to folks that are already using a clearinghouse for some of their payers, but are not established with the board just yet. So you only need to contract with one electronic submission partner that is approved on the approved list. So there's not a need to contract with more than one. And should there be a situation where one XML submission partner needs to send something to another XML submission partners, they'll work that out amongst themselves. But you as the provider only need to contract with one approved partner.
There's a question whether or not this applies to all specialties, including physical therapists, and the answer is yes, everyone must go electronic.
There's a question on what the cutoff date represents in terms of August 1st, 25, whether it represents the date of treatment or the date of submission, and that's the date of submission of the bill, right? So if there's a lag time between date of service and date of bill submission, it doesn't mean that all of the service dates up to and including July 31st can be still submitted in paper. It's whenever those bills for the service dates for July 31st or whenever those bills are submitted. Once it's August 1st or later, it has to be through electronic submission partner. So 8.1 refers to the date of submission of the bill, not the date of service.
There's a question, what is the expected turnover time for payment from the clearinghouse submission to receiving a check? Carriers are supposed to respond within 45 days. If this does not occur, we strongly encourage you to file an HP1 to get assistance with disputed medical bills.
Hi, there's a question as to whether or not billers need to be added to providers portal as delegates in order to bill these electronically. That's a great question. You may be referring to onboard and the addition of delegates to submit HP1s and prior authorization requests. This is separate and apart from that, so you don't need to assign a delegate in order to submit bills. Rather, contract with that submission partner and take it from there.
There's a question, is reimbursement for claim submission included in the payment from the insurer or a separate payment from New York State? That's a payment from the insurer. So that's why it's billed using the 99080 code and included on the CMS-1500 form. So the provider will submit to the insurer for reimbursement, again, up to $1 for whatever the costs are for submission of that paper form or electronic form. This is Dr. Tachi. There's a couple of questions that we could handle quickly. One is, what if a payer still doesn't take electronic bills? As noted before, all payers are required to accept electronic billing. If you have a specific carrier that you have specific examples where they're not accepting the electronic bills, either you or your submission partner can collect that data up, send it into us at the board. We have a payer compliance unit, and they will look into that. There's another question that states, so the carriers will send a copy to the workers' comp board. I assume that means a copy of the CMS-1500 form and any attachments that it might have. Actually, your electronic submission partner will send a copy of the CMS-1500 and the attachments both to the carrier and to the board.
Hi, we have a question regarding medical attachments and medical documents or daily notes that go along with the CMS-1500. Those medical narrative attachments will be processed along with the CMS-1500 through an electronic submission partner. So those same attachments will go electronically as well.
Hi, this is Paula. There's a question asking if the board has capabilities of accepting the UB04 electronically from the submission partner. The answer is no. The UB04 is not currently accepted electronically.
This is Dr. Tachi. There's a question that says, what about Form 4.3? I assume that means Form C4.3 that's used to document permanent impairment and maximum medical improvement. That form does still exist. It was not replaced by CMS 1500. You would bill for the permanency evaluation using the CMS 1500 form, and you would attach the form C4.3 as the medical narrative to that CMS 1500 bill. So you would bill through CMS 1500, and you attach C4.3 as the requisite medical narrative. It was mentioned briefly in the presentation, but it's worth reiteration. Do not submit the C4.3 alone, or do not submit them both separately, because if you do, it will, for lack of a better term, gum up the works, both with respect to the processing of the C4.3 form and the patient's determination of permanency, but also for your reimbursement.
Hi, we have some questions in regards to the cutoff date for electronic submission. Is it the actual date of treatment or the date of submission? It would be the date of submission. So any bills submitted as of August 1st, 2025 should be going through the electronic submission process.
Hi, there's a question as to whether or not the submission requirement applies to documents sent to the board, as well as documents sent to the insurance carrier. And once you contract with an electronic submission partner, that submission partner will then send the bills both to the board as well as the carrier.
There was a question on how to contact the medical director's office. I put our email address, our most generic email address that we have in the chat, but it's just mdo@wcb.ny.gov. And someone will direct your MDO inquiry to the right place. There's a question, so this might have been discussed in previous webinars, but can you still do HP1s? And the answer is yes, the billing dispute process is alive and well, and HP1 forms are submitted through Onboard.
Hi, there's a question with respect to the medical narrative. And our medical narrative report template is on the Workers' Compensation Board website. If you'd like to use that, again, it's just a suggestion. With every CMS 1500 submission, there is a required medical narrative, but you can find the template on our website. Hi, we've received a couple of questions as to whether or not we're accepting electronic submissions now, and the answer is absolutely. And we, as indicated earlier, we encourage you not to wait. Contact with those submission partners, and yes, we're accepting electronic submissions as of now.
Hi, we're seeing some questions in regards to carriers not accepting claims electronically. All carriers that accept bills for workers' compensation in New York should be accepting claims electronically at this point. If providers are finding that carriers are not accepting claims electronically, please reach out to the board. You can submit an email to the CMS-1500 mailbox at CMS-1500@wcb.ny.gov.
There's a question, this is Dr. Tachi, there's a question as to whether operative reports can be uploaded with the claim. The answer is yes. Just as you would upload any other medical narrative to support the bill.
Hi, there's a few questions with respect to those providers who treat in the emergency room or in an urgent care situation. In those situations, the bill would be submitted via a UB04. So again, that would be upon the hospital to submit that bill, and that is an instance where there is no electronic submission. So again, that would be via the hospital via form UB04.
Hi, we have a question here asking about line 9A on the CMS 1500. Yes, that is the WCB case number. The WCB case number goes in line 9A on the CMS 1500.
This is Dr. Tachi again. There seem to be several questions about the electronic submission partners and who they were and how to find them and their contact information, etc. So I just put in the chat a link to the board's website that talks about the electronic submission process, and it lists our electronic submission partners.
There are a few questions as to whether or not the electronic submission applies to suppliers such as DME suppliers, and the answer is yes, this does apply to all providers, including DME suppliers.
There's a question asking about resubmission of unpaid bills. Do we also have to do it electronically? The answer is yes. Resubmission would also be electronic.
This is Dr. Tachi. There seems to be a bunch of questions still about code 99080. I also went ahead and put that link to our website into the chat if people want to cut and paste it. Long and short of it is the code can be used now. It goes on the same CMS 1500 form that you're seeking the reimbursement for. It's for up to $1. It's not for $1 every time you use the code. If your clearinghouse charges you 25 cents or 50 cents or something less than $1, then you put that amount in as the billed amount. If they charge you more than $1 for submitting it, then you would put in a maximum of $1. And it's alive and in use now, so you can start using that code anytime. And just to clarify, out-of-state providers have to bill electronically as well.
We're getting a few questions regarding Social Security number again. I just want to reiterate that it is an optional field on the CMS 1500. It's not required to be entered on there. In some cases, it is helpful to have that information, but it is not a required field.
Okay, thank you to everyone for joining us today. Before we sign off, I would like to remind you to sign up to receive workers' compensation news, including information on future webinars and the availability of a recording of this presentation straight to your inbox. To sign up, visit wcb.ny.gov, scroll down to the bottom of the homepage, and select Get WCB Notifications. We also distribute information via our social media channels, so please follow the board on Facebook, X, Instagram, and YouTube. Thank you again for joining us, and enjoy the rest of your afternoon.